Welcome to Behind the Screen, a podcast series from BreastScreen Victoria. I'm your host, Dee Mason. BreastScreen Victoria's stated mission is towards no deaths from breast cancer in Victoria. Now, in episode 1 of this series, we looked at the big picture of breast screening, what the program does, who it targets, and the impact it has on saving lives. The key takeaway from that conversation was clear. While many factors contribute to improved outcomes for women diagnosed with breast cancer, early detection really remains the single most powerful tool we have, and that makes access to regular screening critical. And while it's often assumed that a free public health service is by definition easily accessible to everybody, the reality and the data tell us that is simply not the case. Today I'm joined by 3 guests who bring very different but equally important perspectives on health equity. Eliza Alford is the Program Manager at Bendigo BreastScreen. She works directly in service delivery across regional Victoria. Cathy Eccles is part of BreastScreen Victoria's consumer network, sharing her lived experience of breast screening as part of the trans and gender diverse community. And Carmel Locaso is a member of BreastScreen Victoria's Disability Consumer Advisory Group, speaking to the barriers and supports that shape access for people living with disability. Together, they help us understand why equity matters, what real access looks like, and why listening to lived experience is essential to improving participation. This is Behind the Screen, Episode 3, Hard to Reach Communities. Eliza, Cathy, Carmel, thanks so much for joining me today on Behind the Screen. I'd like to start off with a question for you, Eliza. I'm hearing a lot of talk around the traps about health equity, and I'm certain that it'll be coming up a lot in today's conversation. Are you able to start us off by explaining the difference between health equity and equality?
If we look at it with the BreastScreen Victoria program, from my point of view, if you're a woman who's grown up in Australia, speaks English, you're on the electoral roll, you have stable housing, you've got a mobile phone, then you're going to get your reminders, you're going to get a letter, you're going to get text messages saying, have you booked your appointment yet? So you're getting that direct interaction from BreastScreen Victoria. Whereas if you've got other barriers, you may not speak English or you haven't grown up with the Australian healthcare system, so you don't understand how it works, then there's extra barriers in front of you. So equity is about not approaching everyone in the same way, but approaching everyone so they get a similar outcome.
Yes. A lot of people think, well, it's a free service and it's pretty much around the state and there's a bus that comes to you if you can't, so it's accessible to all, but it's not. So equity is about giving everybody the exact same fighting chance to access a service, which might be directly targeting some communities. Yeah,
that's right, putting extra effort in where it's needed.
BreastScreen Victoria has identified communities which they consider they're hard to reach communities. What are they?
The Aboriginal and Torres Strait Islander population, other multicultural communities, and you can split that into having a separate offshoot of refugees, the LGBTIQA plus community, and the disability community are sort of the priority areas that BreastScreen Victoria is looking at.
So part of their strategic plan is that everybody should have not only equal access to the service, but that we should be working towards having everybody in Victoria, regardless of what communities they belong to, screened at the exact same rates. What is the general rate of screening amongst Victorian women?
The statewide participation rate is 52% based on the latest data. So if we then look at the hard to reach communities, women of a multicultural background screen at about 39% of the eligible population. Aboriginal and Torres Strait Islander women screen at about 41% of the eligible population. So with all of those stats, we're talking about women in the target age group of 50 to 74.
We don't have a reliable data set of LGBTQIA plus Victorians because it's not a census collected data. And even if it were, a lot of it's self-reporting, isn't it?
Yeah, that's correct. So you can't get the definitive statistics, but we do know from other health reports and studies that people from that community are accessing preventative health measures like mammograms at a much lower rate than their heterosexual counterparts.
What's your best guess as to why?
Look, there's a number of barriers, but I think there's previous experiences in the healthcare system, not knowing how they'll be received there, particularly for the trans and gender diverse community, not knowing whether they should be screening and not knowing whether they're going to be treated in a welcoming way when they get there.
I know anecdotally that people, not just from the LGBTQIA plus community, but from other communities is that once you've had one mammogram, you go, oh, that wasn't so bad. It's like anything, isn't it?
Yeah,
I think
we
a lot of people
often find that. And there's so many scary stories that we've all grown up hearing. But nearly everyone who has their first mammogram says to me afterwards as the radiographer, oh, that wasn't as bad as I was expecting.
So you're actually at the coalface in that you can speak to what women are feeling when they actually appear for their appointment. So what is the sense you get from women when they arrive at their appointment?
For a first timer, it can be quite intimidating, not knowing what to expect. But that's part of even just the preparation when we bring someone into the room for the first time. We'll explain exactly what we're going to do. We always make it clear that they're in charge so they can ask us to stop at any point. And sometimes that's because something's hurting, we can adjust. But if they really want to stop totally and say, this is not for me, that's fine as well. Showing them the machine, working out what we're going to do and explaining all the touching and that sort of thing so that they know what they're going into before they take their top off and get started.
For some women, it is simply a matter of modesty.
Yep, certain backgrounds, certain past experiences or how they feel about their body and that sort of thing. Lots of things can play into it.
We will be taking an in-depth look in the next episode at breast screening in the Aboriginal and Torres Strait Islander community. And in that, we'll be delving into the way initiatives like the Beautiful Shawl Project are improving women's participation in the program. But while I've got you here, Eliza, I'd love to get some of your knowledge and experience also, because you're working up there in Bendigo on Dja Dja Wurrung country. Can you tell us about your experience working with community and at what rates they're participating currently?
So across the state, Aboriginal and Torres Strait Islander women are participating at 41%, which has been growing over the years with a number of things that have been put in place. We have developed relationships in the past with the local Bendigo and District Aboriginal Co-op. I find that always helps, having contacts in those organisations that can recruit for BreastScreen and approach individual women and ask if they've had their BreastScreen. And then, as you said, the Beautiful Shawl Project coming in, the mobile screening van goes out to those Aboriginal health organisations and really gets in where it's needed.
The big pink buses are so visible, and I'm sure they've been a massive help in servicing regional Victoria. Tell us about how the buses work and why they work in the Indigenous and other hard-to-reach communities.
BreastScreen Victoria's got a mobile screening service, or sometimes called the bus or the van, and it goes around to regional communities. In recent years, it's been going directly into the Aboriginal health organisations, the ACOs, and it'll park up there. It'll have the support of the health workers there to recruit women to come and have their mammograms, and also the ability to run information sessions.
Well, of course, much of regional Victoria has changed over the last 10 to 20 years in terms of not just sheer population growth, but also its demography as various migrant and refugee communities settle in different regional centres. Can you talk to the ways that Bendigo is changing and how that's created the need for change in the way that BreastScreen Victoria approaches service delivery, and particularly as it pertains to hard-to-reach communities?
Bendigo has been a fairly English-speaking community for a long time. Now, in recent years, we've had an influx of Karen refugees from the Myanmar region. Karen is now the second largest language spoken in our region after English. While we're not a particularly multicultural area compared to Metro Melbourne, we do have a sort of unique demographic where we've got a large group of former refugees and also a smaller refugee population from Afghanistan as well.
The source of the database that drives the letter, the invitation to come for a BreastScreen, is the Victorian electoral roll. Naturally, newly arrived immigrants, people who are not resident in Australia or are not citizens of Australia, are not on the electoral roll. How does BreastScreen Victoria go about creating an environment where women feel that they can come and make an appointment if they're not invited by letter?
There's a number of community promotion avenues that we can follow with that, attending community events and that sort of thing to promote BreastScreen. In Bendigo, we have Bendigo Community Health Services are the first port of call for all refugees to the region. We've built relationships with them and they will actually promote BreastScreen and having a mammogram to newly arrived refugees. And we've got systems in place where they can actually make a referral to us. Not that you need a referral for a mammogram at BreastScreen Victoria, but they can send us one and then we'll get in touch with those clients.
When we talk about cultural differences and the role of not just mammogram but public health, a lot of these women are travelling from communities where there is no community-free healthcare, much less a mammogram every 2 years. rather than arrive here and go, yippee, I get free healthcare, there's some other things at play. Talk to me about the psychology of particularly refugee, but certainly immigrant women taking up offers of public health such as this.
Yeah, look, I think the first thing to say is we can't necessarily lump all multicultural women into having the same barriers. There might be different barriers based on what part of the world they've come from. So it's really sort of important to approach communities and build relationships and understand the barriers and also what will work for them. There is potentially a very low health literacy. If they've been in a refugee camp that has one medical centre, they're used to approaching that for acute medical issues, but the concept of preventative healthcare might be entirely unknown to them. So you can imagine approaching a shiny, big healthcare system is intimidating in itself, but then you might not even have the understanding of the point of having preventative healthcare. There can be misunderstandings and misconceptions as well about breast cancer that create a barrier. We've heard from some communities that they believe that breast cancer is not treatable. So why would you have a mammogram in the first place if it's not treatable?
Which may well have been true in their country of origin.
Exactly, yes, based on their own personal knowledge. Some communities will have a mistrust of healthcare systems based on what they've seen. And I think also historically with the Aboriginal and Torres Strait Islander people might also have distrust of healthcare systems based on very real things that have happened in the past.
We've talked about refugee and newly arrived migrant communities, but there are some very well established communities in Australia, third, fourth generation Greek, Italian, Chinese, Arabic communities that still have sort of ingrained distrust, mistrust or cultural norms that really prevent women from getting along to their mammogram. Do you want to talk to me about your understanding of those issues?
So some cultural norms, there might be embarrassment about the body or shame, or some communities or many communities, the women might be putting the needs of their partners and their kids ahead of themselves and therefore not believing that they're a priority and getting along for their mammograms. BreastScreen Victoria has translations in quite a number of languages. But yeah, one of the things we've done with the Bendigo situation is that we've been able to advocate for resources to be translated into Karen. And we've been able to put the communications team at BreastScreen Victoria in touch with Bendigo Community Health Services who have bilingual health workers. So we've been able to connect those two groups to work together and get translations done for the Karen community.
One of the other things about language is that a lot of women also don't read in the language that they speak. That is common across the board and certainly in second and third generation women as well. The language that's spoken at home might not be the language that they can read as well. This goes to the idea of somebody calling a woman and giving a reminder in language. Why is that important?
Yeah, that's great. As you said, people might not be able to read in their own language either. And we know from research that's been done that the booking process can be quite onerous. You can use the translation service through the phone lines, but that is a bit of an onerous task to go through. So that first step of even making the booking can be quite off-putting. BreastScreen Victoria has done outbound calls to clients in a number of the top languages or the most common languages in Victoria. And that was a model that we saw and we decided we wanted to bring to Bendigo. So we've put a program in place where we can identify clients who are due for their screen. They've had one in the past and they're due again, but they haven't made a booking. And also referrals from Bendigo Community Health Services who see the incoming refugees. And then we will use our local interpreters at Bendigo Health to call those clients and offer them a booking all in language. And they're working from a script, so they're not having to stop and start. They can read through the script and they sit beside one of our administration officers who can make a booking at the time.
It would be quite a good telecall centre to work in because you're not going to get hung up on, because I imagine people are just so thrilled to have somebody speaking to them in language.
Yeah, that's right.
So they'll listen.
Yep. It's fantastic. Yeah, yep.
So you know what I love about all of that? You guys really want women to get screened.
We do. That's our whole thing.
Yeah, you really are. You're really into it.
Yeah, and look, working with the interpreters, we've all got a better understanding as well of the community and some of the challenges and ways we can work with them. So it's really been great for our staff as well to build that relationship and have a better understanding. Now,
we will be talking about the Beautiful Shawl Project in the next episode, but I know that up in Bendigo, you've got some shawls for the broader community as well. And what's the impetus for covering during a screen? And who was the genius that came up with the idea of putting it on backwards so that the gap's at the front?
So for a long time, all of our clinics have offered a gown with sleeves to pop on for a mammogram for people who feel like they want a bit more coverage. But the shawls that you're speaking of are just like putting a big scarf around your shoulder with a tie in the front and no sleeves. So it's much easier to flick it out of the way for each side. If you're screening the breast on that side, you can still be covered on the other side, and you don't have to take your arms in and out throughout the mammogram, so it makes it much easier. So yes, they were first brought in on the van as part of the Beautiful Shawl project, but then it's been recognised that they would be a great resource everywhere. So we in Bendigo are part of a trial offering them to all clients at the moment, and then I'll get the feedback on how effective that is, if there's any sort of demographics that found them more necessary than others. Part of the trial is the survey that all clients receive at the end will have extra questions in it asking about the shawl and how you found it, whether you thought it was necessary or whether you did just take it because you thought it was a beautiful shawl.
Yeah,
yeah, that's right.
Is it a take-home thing, or are you?
It is a take-home, yeah. Wow. So, and we have a very stylish person in our head office who has shown us how you can tie it nicely as a scarf to wear in your general day-to-day as well. So. Well,
that's a good social media post waiting to happen, isn't it? It's 12 ways with my beautiful shawl.
That's right. So yeah, we're really keen to see the feedback and whether a huge number of women say that they found their mammogram more comfortable. Even weather-wise, we're finding we're giving more out on cold days than hot days at the moment.
Right.
So it's just that little bit of extra warmth.
Eliza, we want by 2026 to have 55% participation rate in breast screening across Victoria, across all of our hard-to-reach and priority communities. What's the thing that's going to get you there in Bendigo? What's the one thing that you really think we need to focus on?
Look, hard to pick one thing because I always think it is a multi-pronged approach and there's not one thing that makes a huge difference. But I'll pick one. I think it is, once you've actually got people there, giving them as best experience as you can, focusing on that individual person, and then they're going to return for their next screen, and that keeps our participation rates up. But not only that, they're also going to tell their friends. So yeah, getting the word out into different communities through individuals is a really great way of getting more people in.
BreastScreen Victoria invites women and trans and gender diverse people aged from 50 to 74 without breast symptoms to have a free 10-minute breast screen every 2 years. Breast screens with us are performed by a woman radiographer and don't require a doctor's referral. With over 50 clinics and 2 mobile screening services across the state, you can choose a clinic and a time that's convenient for you. Book at breastscreen.org.au or call 1320 50. I'd love to bring you in at this point of the conversation, Cathy Eccles, because as a member of the BreastScreen Victoria Consumer Network, we know that you're passionate about the service, but also as a member of our trans and gender diverse community, you can also share your lived experience of screening within a community that's been identified by BreastScreen Victoria as a hard-to-reach community. Now, we know statistically that people in the LGBTQIA plus communities are less likely than the broader community to participate in screening programs generally, cancer screening generally. And they also present with higher rates of various cancers. And certainly there's data to show that people from the LGBTQIA plus community are less likely to have they're less likely to have ever had a mammogram and less likely to have had one in the last 2 years. Now, I know it's a big question, but what are your first thoughts, Cathy Eccles, as to why that is? What could be contributing to the low rates of participation in the community, and maybe more specifically in the trans and gender diverse community?
The best thing I can say is my own experience, and that was early on when I hadn't been. So fear of the unknown was certainly a big thing there, and you're wondering if you're going to end up in a waiting room that's packed full of women looking down their noses at you and judging you. And that's far from the truth.
I'm sorry to hear that is even something you have to worry about, but is that based on experience you've had?
Oh, I think early in your transition, you're obviously worried about everyone looking at you. You know, hormones haven't taken effect. You look like a guy in a dress.
Yeah, see, it's something I just wouldn't have occurred to me to think of being an issue. But it's good to know, because this is why we need this lived experience. Can I ask you, Cathy, if you're happy sharing, can you tell us a bit more about your transition journey, what role hormones have played in that for you?
I started in 2013. Well, in reality, my first recollection, I was 5 years old, but I started properly transitioning in 2013, went on hormones around 2015, and then around 2017, 18, I came out fully at work and everywhere else. And so it's been about 10 years.
But nearly 10 years on hormones.
Yeah.
Did you, as part of that transition, augment your breast, or have you gone through the hormone method?
No, mine are natural.
Okay, so that's something I think a lot of people perhaps, and maybe our listeners don't know, is that trans women can develop breast tissue through using estrogen hormone replacement therapy. Was it a decision for you to go into hormones as part of your journey?
A decision. It was the easiest decision I've ever made. It was a no-brainer.
Were you aware or made aware by any of the health professionals you talked to that breast cancer was something that was going to then, the possibility could enter your life?
Oh, I was certainly aware of that. Yeah. I mean, they're natural breasts, so 2 plus 2, it's pretty obvious. It's not something that happens overnight. It's a change in your own self-awareness, and then change it's a realisation that, gosh, I have actually been a woman. That's how I was born, and I was in the wrong body. And that's why this happened and that happened, and there are milestones all the way through your life, and then it all, last jigsaw puzzle piece fits into place, and now I'm happy.
And then once you've had hormone treatment for 5 years, it is essential that you start breast screening.
That's right.
And so you maintain every 2 years?
I do.
Do you find it painful in any way?
I've had it 3 times now. The first 2 not at all. The third time, I wouldn't call it painful, perhaps uncomfortable, the pressure, but really nothing. No.
Do you feel accepted into the BreastScreen clinics?
Oh, absolutely. You run on time, you go in there, there's probably only one other person there anyway, you don't have to wait too long. Honestly, you're in and out in no time.
Do you know that everybody I speak to says that they're the one medical organisation that runs on time?
Oh, you guys are the best for that.
But it's, I mean, we laugh, but BreastScreen Victoria has spent quite some time making sure that everybody, from the receptionist to the radiographer to the radiologist, is trained in. And in fact, they've gone through the process of getting the rainbow tick. Do you know anything about the rainbow tick? Can you talk to us about the rainbow tick?
Well, it's an auditing tool for organisations to become certified and compliant with issues that relate to people who are in the LGBTI community. So it's a wonderful program. In my own business for many years, we had an ambition to get that, but it was a big job. There was a lot of training and cost and work in getting it.
What could be something that's inhibiting trans and gender diverse people from getting their screening?
I think the feeling of being judged or othered is probably the biggest thing that in our community we feel. I was fortunate in I had a really good endocrinologist, and she put that to me very early on. And the rainbow tick it gives you a lot of reassurance when you see that on the door. I didn't have any issues. So it'd be fair to say if you've got breasts, you're eligible, and you guys don't really care how we'd identify. Correct?
Eliza, in consultation with groups like Thorn Harbour Health and Transgender Vic, BreastScreen Victoria made the decision to adopt the term chest screening rather than breast screening for people who perhaps don't identify as having breasts. How important do you think language like that is in encouraging people to get screened?
Yeah, I think it's just about being inclusive, and a certain percentage of the population, particularly trans men or gender diverse people, intersex people, might see that and realise, okay, this might be for me as well, even though I don't consider that I have breasts. I would refer to it as the chest, that this might be an option for me as well. We do have very clear guidelines online, or we can print it out in the clinics about who is eligible and who it's recommended for. But yeah, phrasing it as a breast or chest screen. But as you say, that is complicated, particularly now that there's the lung cancer screening has just come into play. But yeah, it's just about sensitive language. And the other thing around that is that we have made an effort over the last few years to be changing the wording to client rather than woman or women. Yeah. Even picking up things, little posters that we had around the clinic. Yeah, some signs that said women that could quite easily be changed to clients, and it just makes it less intimidating for trans men that might be in the clinic. And we're happy to answer questions. If people are not sure and they want to come in and ask someone, we'll talk to them about their eligibility. And if we're not sure, we'll direct them to where they can get the answers. And if I can just add to that, over the last 10 years or so, as these policies and recommendations have been developed, it has been staff asking for, we want to know how to best support this community. So yeah, staff education has been really key to people just having enough information to confidently be able to perform the best service for people.
Down here in Melbourne, we had a rainbow screening session where the bus came to St Kilda here near Pride Centre.
Yeah, fantastic.
And we're encouraging people from the LGBTQA plus community to get a screen. How important is targeting the bus directly at communities like that?
For a start, it's really visible. It's pink and it turns up in the community and people get that reminder. And there's other ways that we've done that. For instance, I've walked in the Bendigo Easter Parade with the rainbow contingent, showing that BreastScreen is a part of that community. The rainbow sessions are offered at a number of clinics around the state. Obviously, we're aiming to be welcoming and inclusive at any time to anyone, but the rainbow sessions offer just that little bit of extra comfort for people from the LGBTIQA plus community who might want to screen with other people from that community and have that extra support there and have a bit more extra time to ask questions of the staff as well and know that they're going to have the answers.
Cathy, what do you think about sessions like the rainbow sessions where the BreastScreen Victoria offers the service for a particular amount of time, or a session specifically for people from the LGBTQA plus community?
I think it's a great initiative, and I know through Transgender Vic that they've had quite successful numbers turning up to them. They can go along with friends and get support and not feel that they'll have people outside our community there that might be judging them. I think it's a good idea.
I imagine that if you're a person with intersex variation that you would have some ongoing contact with a medical professional, and I imagine that that's come up. But it's no excuse for us not to have at least looked into it and have an answer. But if the answer is consult with your general practitioner, then...
Yeah, the official advice is consult with your practitioner.
If you present with breast tissue, you can go and get screened.
If you have breast tissue, if you want a mammogram, we're certainly not going to turn you away, and we're not going to quiz you at the desk about whether you are intersex. If you present and say, I would like a mammogram, and there's nothing indicating that we shouldn't do that, you haven't had top surgery or anything like that, then we're going to go ahead. People that have had top surgery or mastectomies for any reason are not screened within the BreastScreen Victoria program. Women who've had a mastectomy on one side for breast cancer, we would screen the other side, but not the mastectomy side. And similarly, if you've had top surgery for gender reasons, you wouldn't be eligible to be part of the BreastScreen Victoria program.
But the risk is not zero.
Yeah, again, another thing to speak to your general practitioner or your specialist about on whether you do still have any breast tissue there that needs a diagnostic mammogram or an ultrasound.
Thanks, Eliza. I just want to move focus now and look at another hard-to-reach community, and that is people living with disability. Now, BreastScreen Victoria has identified through its diversity and inclusion pillar in the current strategic plan that there is a need to improve accessibility and inclusion for people with disability as a priority. On some levels, it's easier for the rest of us to get our heads around the barriers to participation for people living with a disability, because oftentimes we can see the physical barriers to access. But not all disabilities are visible, and our guest Carmel knows all about that. Carmel, you're on the BreastScreen Victoria Disability Consumer Advisory Group, and you're also a part of the Consumer Network. So welcome.
Thank you.
Now, do you mind sharing the nature of your disability? Because as I just alluded to, that not all disabilities are visible to the rest of it.
Mine are pretty much cognitive. So I have trigeminal neuralgia. I have quite a few different conditions that become a disability.
I met you, we talked for an hour, and then at the end I said, do you mind me asking why you're on the Disability Consumer Advisory Group? And that must be in and of itself a barrier. If people don't perceive your disability, do they treat you differently because there's some assumed capacity that you don't have? Can you just run us through again, what is your disability and how does it impact you?
Okay, so people can't see my disability, so they make assumptions about, my abilities. So when cognitively I'm not doing well, it's sort of then I see, especially with my family, I'm able, I'm not disabled. So it's very different, and mine's quite difficult. So my medication then makes it even worse. So once I'm on my medication, it actually affects my cognitive memory. So I have good days, bad days. So that's my disability.
And I imagine it's hard to plan around those good days and bad days.
Absolutely.
And I guess because your disability is a cognitive one, how does something as simple as getting along to your mammogram every other year impact you?
My mum reminds me. My elderly mother reminds me. I get the letter, and if it just goes into my diary, I will lose that letter. So I need a bosom buddy to remind me, and the group thing and having other women encouraging you to do that, or reminding women, like we talk about all other things with our friends, and we encourage each other to do other things. But this is amazing, like to be able to get along there with your friends and have a screen. Yeah, absolutely amazing.
Carmel, you're on the Disability Consumer Advisory Group for BreastScreen Victoria. Tell us a little bit about how you got on to that and what it does. What's its function in BreastScreen Victoria?
I'm also a big advocate for BreastScreen Victoria. I think that they're doing an amazing job, and they've always done an amazing job with me. The opportunity came up through an email. It was an invitation. My friend had breast cancer at the time, and this was my way of giving back. So I decided to join. Like, my philosophy in life is if you can give something back to your community, you just do so, be it little, bit big, in any which way. So I was happy to do that. Do I fit the stereotype of the educated white woman who has a telephone and stable accommodation? Possibly, but I also have a disability, and that is a barrier. I don't like the label because I just think I'm actually a human being, but, you know, I have to fit into a category. I just believe that we should all be treated with dignity and respect. We just all need to be treated the same way. And like I said, BreastScreen Victoria does that quite well.
We've got lesbians with disabilities, and we've got people from newly arrived communities who are queer or trans, or, you know, so each of these communities interact in various ways. But I love your approach, which is if we just treat everybody with the same respect, this is about equity, isn't it?
Yes.
About giving everybody the exact same opportunity to participate.
That's right.
And that's going to be the thing. It's what Mother always told me. Every interaction you have with somebody, you don't know what they're going through.
We actually don't. And we do have a lot of crossover. So it's how we treat that human being. I'm just a human. So for me, it's just getting it out there that this is an important service, and there are barriers, definitely barriers, especially after listening to Eliza. And for me, it's like, let's get our friends together. I mean, and let's work in empowering each other to go have these screens.
Talk to me about support animals or support persons.
My mum's my support person. She's amazing. Like she's my reminder of everything. Like I said, I've had really positive experiences. I've walked in from the receptionist right through to the radiographer. Everyone has been extremely respectful.
Have you had anybody, Eliza, come into your examination room and want to bring with them a support animal or a support person? And is that something that we allow?
Yeah, absolutely. Support animals, very welcome, no issue there. Usually, you know, a guide dog or whatever will very happily lay in the corner and cause no concern. Certainly, we do welcome a support person in whatever capacity the client themselves wants. So they could come in and help them get changed and then step out, or they can stay in for the whole thing and step behind the radiation screen with the radiographer.
I love it that behind the screen's coming up organically in the podcast.
Right. And the other thing I would say is we're always very happy to be told anything people want us to know about them that makes it easier for us to do the mammogram with them. So a lot of the time that information is collected at the point of booking. There is a question about disability, and there's a question about a very new question about whether you would like us to know anything else that would assist. But if you step into the room and there's something that you might not have said at booking that you'd like us to know, sometimes we do get people say, I've got fibromyalgia and I'm having a flare-up today, so I need you to be extra cautious in whichever way. A lot of people will say, I've got a dodgy left shoulder, so we know we have to be extra cautious there. So anything you think. And then often, if you're comfortable with it, we'll make a note for the next radiographer in 2 years' time, so we know that in advance as well.
Well, it's common sense, and it doesn't have to be an acknowledged disability. I have a dicky rotator cuff in my right shoulder, so I'm going to tell a radiographer, absolutely, just be careful.
Definitely,
there.
Yeah.
So I guess if you think of it like that, like I've got physical limitations and I need them to know, so that's why complete transparency with things like that is sort of important.
Yeah.
Can I ask you, Carmel, in your work on the advisory group, but also just in your life, and I know it's hard to generalise because all disabilities are different and all abilities are different, but what do you think are the main things that make it hard for people living with disability in Victoria now to access the service?
We know about having a breast screen, but not everybody does. And does everybody have an understanding that it's important? And when you're busy, like I'm a mother, a grandmother with a disability. There's times I don't even think about it. I'm just thinking about people that don't have access or don't know about it. I don't think everybody knows that they can have a free breast screen.
Well, also, we're talking about a very rapidly changing media landscape. I think a lot of media is now online, and I think that it's hard to reach people who are not operating in that space.
That's correct. And they're the people that BreastScreen Victoria is looking at because they are not in that space. So what other forms of media can actually be used? Because there is quite a few. We assume that everybody knows how to do things online, but not everybody knows how to do things online. Not everybody has access to do things online.
I also think ambassadors such as yourself do an amazing job to get the word out, because it's word of mouth, but through ambassadorship, that's really
I agree.
Powerful.
You need real people telling real stories. Yeah, sharing their stories.
That's why everybody's tuning in to Behind the Screen. Why is the invitation letter so important? I'd hate to live in a world where the invitation letter doesn't go out in the mail, but one day that's going to happen, Carmel. You know that.
Correct.
Maybe not in the near future.
Then I'll forget my appointment.
So I guess there is an argument for people saying, why are we printing all these letters? And there is the opportunity that you can go get your notice electronically. I choose to have a letter because I want to file it away with a colourful letterhead and put it in my thing. But I'm sure that I'm a dinosaur. So how important is the letter to you?
Well, the letter to me is really important. But again, it could be a question asked. How would you like your reminder? Would you like it electronically? Would you like it mailed out? Would you like an SMS? So you can always ask the participant, what do they want? Don't make assumptions. Everybody will use whatever that they need to pick up on what they need to do to get a breast screen.
I'm going to let you all go, but I just wanted to ask you one final question, Eliza Alford. If you could speak directly to one woman, say from the multicultural community, who is yet to screen or is thinking about it and just needs that final push to feel comfortable coming to BreastScreen Victoria, what would your advice be?
I would say we are here to support you. We have access to interpreters, and we're very happy to book you in with an interpreter. You can bring a member of your family to support you or another member of your community, and we'll do everything we can to make you welcome and happy with your appointment.
Big thanks to my guest today, Eliza Alford, Program Manager at Bendigo BreastScreen, Cathy Eccles from BreastScreen Victoria's Consumer Network, and Carmel Locaso from BreastScreen Victoria's Disability Consumer Advisory Group. Behind the Screen is available on podcast platforms and via breastscreen.org.au/podcast. Come and join the conversation on Instagram and Facebook. Make sure to like, follow and subscribe so you'll be notified weekly when each episode drops. And if you know someone who's curious about breast screening or could really benefit from these conversations, do feel free to share. Thanks for listening, and please tune in for the next episode where we will be continuing the themes of equity and access, but really focusing specifically on the Aboriginal and Torres Strait Islander community. I'll be joined by Auntie Jill Gallagher, CEO of the Victorian Aboriginal Community Controlled Health Organisation, VACCHO, Nicole Laurie, Director of Communication and Client Engagement at BreastScreen Victoria, and Auntie Deb Mellett, CEO of Jambana Aboriginal Controlled Community Organisation. That's all next time on Behind the Screen, Episode 4, Aboriginal and Torres Strait Islander Women.